I know you are not very familiar with Dr. Koki Mutua. Dr. Koki Mutua is the Director for Public Health. And don't confuse Director for Public Health. And then you ask, what is Kuria? Kuria is head of the Directorate of Public Health. Please proceed, Dr.
For the air travelers specifically, with effect tomorrow, they will be provided with a link from their airlines and also from the booking agents. With that link, once they click the link, it will bring a surveillance form. In that surveillance form, they will be able to fill the details as shown in the surveillance form, and then they will submit. Once they submit, they will be given a QR code, which they can save, or it will be in a PDF form. Then they will proceed to the health desk. Once they get to the health desk, the healthcare provider will screen, and they will fill the details, like if it's a temperature, they will fill the temperature form in the surveillance form, and then they will release them if they are to be released. From there, the person will be prompted to give the daily readings for the temperatures for 14 days, still in the app. And then if you don't give the temperature readings, you will be traced by the contact tracing team. So we are expecting that the travelers will comply, and it will be easy for them. They're supposed to be filling this form at least before travel. So when you're booking your air ticket, you also pick this form and fill and submit, so that when you get to the destination country, like if it's Kenya, you already have all your details online. So I think that is it. Okay.
Asante, maybe you can now take questions, a few questions.
Thank you so much, CS. Satolale, NTV. This morning we saw a huge number of Chinese nationals leaving the country. This is, first of all, before the official reopening of the airspace in terms of international travel. Second, why so? What do they know that maybe we don't know? Are they scared maybe of an eventuality? I'm just speculating, but also a concern for Kenyans. That is number one. Number two, it's about leaders disregarding the social distancing rule. Waziri, we've had funerals where a local chief come and chase away people who are mourning just because there are like 20 people, but we've seen politicians going to funerals and there are huge crowds. Why is there double standards in terms of this? Thank you.
My name is Chemutai going from Citizen TV, and possibly maybe you can tell us whether you have given guidance to the Bukusu and Tachoni communities regarding protocol for the cut, noting that the events have seemingly begun starting yesterday and today. And then second, you may have touched on it a little bit, but in the last 2 days there have been 30 deaths. COVID-related deaths. Just possibly what is pushing these high numbers, and especially even just among the young people?
Waziri, shikamoo mgwana.
Marhaba.
Haya, naitwa Boni, nafanyia Weru TV kazi. Swali langu boga kabisa. Ningependa kujua andi saizi wizara imetumia pesa ngapi kupigana na hili janga la corona? Asante.
I'm Brian Otieno from KTN News. Yeah, there seems to be a sudden drop in the number of recoveries, especially from last week. Is there an explanation to this?
Nancy Okware, KBC. Swali langu ni kuhusu wale wagonjwa ambao wanapokea matibabu kutoka pale nyumbani. Tumekuwa tukipokea malalamishi kutoka kwa baadhi kwamba walipopimwa na kupatikana kuwa na virusi vya corona waliambiwa wajitenge. Lakini wakiwa pale nyumbani hakuna wahudumu wote ambao wamezungumza nao kufahamu hali yao, na hivyo basi wanahisi kwamba wametelekezwa. Je, wizara inasema nini kuhusu madai hayo? Na vile vile hivi majuzi mlisema kwamba mtahakikisha ya kwamba familia zinafunzwa kuhusu jinsi ya kuwatunza wagonjwa wasio na zile dalili. Je, kufikia sasa mmefikia wapi katika mfumo huo? Asante.
Asante.
George Kimaso from People Daily. This is a little bit different from the update. It's on immunization. we've seen since COVID, we've not had anything to do with immunization. UNICEF has said that about 20 million children across the world are dying. So in Kenya, what are the preparations for this, or what is being done, and what does this portend for Kenyan children?
Thank you. Okay, asante sana. Seth, let me start with you about the Chinese and whether we are concerned or not. The first thing is that we are not concerned about people traveling. The reason being, Seth, that we have also got plane loads of Kenyans who have, for example, left the UK, left the US, and come back home. So there are very many Chinese in Kenya. And I'm sure that they probably had an arrangement where they were going to be evacuated. And as far as these protocols are concerned, the fact that you have been told that, and we have said that we are opening the airspace, perhaps they had already organized something, because you never know. We could say we are opening, we have a disaster, and then we don't open. So I believe that, like you, if you said that they might know something that you don't. Well, if you don't, I don't either, because we are exactly in the same boat. I presume that they don't. There is nothing they know that you and I don't know. I think it is generally just in their normal way of traveling, and maybe just evacuating those they might want to evacuate. They are free to do so. We are also doing the same with our people elsewhere. As for the funerals and what you spoke about the chief, you know, when the president spoke 2 days ago, and we have also followed up with the same, we have insisted that burial protocols are observed. I attended a burial, for example, yesterday, and I can tell you that they were observing the distances that are required and what have you. And if there are 20 people attending a funeral, or between 15, 20 people, and they are all social distancing, there would be absolutely no reason, to go and disturb them or to go and stop them. And in fact, that is the worst times that you can possibly, engage people in something or subject people to something like that. So I don't know which particular area that was, but I just want to say, and it is good that, Seth, you have asked that question, because it gives me the opportunity to say, we are all very concerned, and we all sympathize with people when they have passed away. We know that a lot of people, like in our African culture, we want to go and say kwaheri to a loved one. We want to go and give sympathy. We may not even know the person who died, but we know the brother, we know the sister, or a relative, and we want to go and keep them company as they mourn. But I just want to ask Kenyans that we begin to appreciate that this is no longer possible.